I'm Dr. Didem Saygin from University of Chicago, section of rheumatology. Thank you so much for having me today, and I'm going to be talking about Facebook and Instagram. I have no financial relationships to disclose. This is the outline of my talk. First, I'm going to be talking about basics of Facebook and Instagram. I know many of you probably have Facebook and or Instagram account, but I think it's important to cover the basics very quickly at the beginning. Then we will be talking about what are the challenges and what are the advantages of using social media, and what are the strategies to minimize these challenges that we encountered with Facebook and Instagram use. So Facebook was established in 2004, about 17 years ago. About 6 years after, Instagram came into our lives. Number of active users has been increasing steadily since then. As of 2021, Facebook has around 2.7 billion users, and Instagram has around 1 billion users. So very powerful social media platforms. How about India? It looks like in January 2020, these YouTube, Facebook, WhatsApp, and Instagram were the most commonly used social media platforms. About 76% of the people reported using Facebook in the last month, and about 64% of people reported using Instagram in the last month. So my area of interest is rheumatology. So if I wanted to see what's out there about rheumatology on Facebook, I would just go and type in rheumatology to the search box of Facebook that's usually at the top. And here you're seeing that the results are displayed in different categories on the left. Posts, people, photos, videos, pages, places, groups, all related to rheumatology. On the right, there are a couple of examples of groups. One is rheumatology and radiology. It looks like I'm already a member of that group. And there are a couple pages here, Rheumatology Research Foundation, American College of Rheumatology. And if you wanted to see all groups related to rheumatology, you can just click on this See All button. A little bit more about groups. There are two different types of groups on Facebook. One is private group, the other one is public groups. For private groups, it means you have to be a member of the group to be able to see the content and posts of the group. Here, for example, this is a group called Physician Women Leadership. I requested to become a member of this group, and they asked my first name, last name, where I work, what's my MPI number. It's a national provider identifier number that every practicing physician in the United States has. It means they're pretty strict, right? They really would like to capture the physicians only. And an admin person, you can see here, reviews the application and approves or doesn't approve your membership. On the right, you're seeing a section called About. It's basically talking about what's the target audience of this group, what's the mission of the group, what are the rules of the group. And this group, as you can see here, it says private group, and it has about 7.5 thousand members. In public groups, you can basically see all the group content and posts without being a member. But if you would like to see their future posts on your newsfeed, means you have to be a member. Pages are similar to groups, but you can see all the content. And if you would like to see their future posts, then you have to click on this button called Like. About section is very similar to groups. Instagram, for Instagram, basically you have to have an account. So they don't have pages or groups, but everyone has an account, either a private account or a public account. For example, on the right, you're seeing Dr. Spagnoletti has a private account. It means I can't see her pictures. I need to follow her or request a friendship, send a friendship request to be able to see her pictures. On the left, you're seeing a public profile. As you can see, I'm not following Dr. Wong, but I can see all of her pictures. So I would say on Instagram, the posts that you can share are usually pictures or videos. But on Facebook, you can share audio files, you can share links, you can share text, so you can share anything that you want. It really accepts a wide range of media types. On Instagram, it's usually restricted to videos or pictures. You can also do live sessions on your Instagram account. You can do stories. These are usually short video clips that disappears in 24 hours. Here you're seeing Reels, Instagram TV. These are different types of videos that you can share on Instagram. I would say these options of sharing video, different types of videos, makes Instagram very popular among certain specialties, such as dermatology, pathology, or radiology, more visual fields. Also, it's very popular among surgical specialties. They use these videos to share different types of surgeries. There's not really many rheumatologists out there or like nephrologists out there who has public professional Instagram accounts. The Instagram is more popular among visual fields and more surgical specialties. So why do some healthcare professionals use Facebook and Instagram? Let's try to understand. So I think one of the first reasons is inspire your patients and colleagues. My personal observation is that majority of my patients are using Facebook actively. That's followed by Instagram, that's followed by Twitter. This could be for multiple reasons. Facebook has been there for a very long time compared to Instagram. And also I think it's easier to use, it doesn't have character limit. So it's much easier to use. I see that if I share a post, I know that I will be able to reach to my patients more compared to when I share it on Twitter. Here in the last month, especially in the United States, many doctors have shared their COVID-19 vaccine pictures, right? They definitely inspired many people who were hesitant to take this vaccine. I felt like this was a great example of inspiring other people on social media. Another reason is sharing medical news that are important to your patients or colleagues. For example, if there's a new FDA-approved drug in the field, you can share this on your social media. If there is a recent paper, research paper, or review paper that you thought was very helpful, you can share that on your social media as well. So you can share your own publications, right? It's a great opportunity to thank all of your patients that participated in the study and share the final product with them. It also encourages more patients to participate in these studies. Also, it can lead to collaborations with colleagues who are interested in conducting similar studies. But this collaboration with other colleagues is probably more true and happens more on Twitter because academic accounts, academic professional accounts, there's more Twitter accounts than Facebook accounts. But I would say my observation is that Eastern European, more Indian, and more Middle Eastern colleagues are using Facebook more than Twitter. So it can definitely lead to collaborations with these people from other countries. Here, for example, you're seeing Latika, one of the organizers of this social media course, sharing her paper in thanking all the patients who participated in this study. I thought it was a good example. Similarly, you can also use Facebook for clinical study enrollment. Here, Dr. Agarwal is sharing one of his NIH-funded studies and encouraging patients to participate. Similarly, Latika had done a study during pandemic examining the challenges that myositis patients experienced during COVID-19 pandemic. And she recruited patients all from social media. It looks like there were 608 participants. That's a great number for a rare disease like myositis. You can also use it to connect with colleagues. So I really like Facebook groups. Facebook groups allows quick and easy organization of individuals with related interests. It provides an interactive learning platform. You can talk about diagnosis or management of difficult cases. It can also be used in job search. I'm a member of the Chicago Land Rheumatologist. I live in Chicago. I see that people post about job openings. People who are looking for jobs also post in this group. So it's very helpful. And it's also very helpful for peer-to-peer communication, mentoring, and bonding. In this group called Physician Women in Leadership, many women who are at leadership roles across the United States are providing mentorship to a lot of people. Also, you can use it as an educational tool. As I told you, videos are very helpful, especially in surgical specialties. Photos are very helpful in specialties like radiology, pathology, dermatology. And if you don't really know what to follow, who to follow, I feel like you can just go and follow the journals that are important in your field. They all have accounts. For example, you can follow New England Journal of Medicine, Journal of Rheumatology. You can follow Lancet, right? You can also follow the professional societies in your field. If you're a cardiologist, you can follow European Society of Cardiology, or the rheumatologist, you can follow American College of Rheumatology. So if you don't know who to follow, then follow the journals and professional societies in your own field. So what are the challenges of Facebook and Instagram use? These challenges are definitely not limited to Facebook or Instagram. So I would say on social media, one of the biggest challenges I observe is maintaining the professional boundaries. On social media, there is often an influx of news and information that can be provoking at times, especially if it's related to politics. So it could be difficult to control yourself from reacting to those news. For example, here you're seeing a rheumatologist with actually thousands of followers. I tried to hide his name, cursing and making political comments, comments about the current president of the United States. I mean, that's not professional, right? But there's been a lot going on in regards to politics in the United States lately. So it could be really hard. So I understand that it could be really hard to maintain these boundaries. And here also we're seeing a picture of a physician who's clearly intoxicated. He was probably tagged by one of his friends who was trying to joke, but of course, it's not professional, and we don't want our followers to see that. So another challenge is the threat to patient confidentiality. For example, the case discussions that we have on social media can cause breach of confidentiality. So certain details about the cases can reveal the identity of the patients. It's important to be careful about that. Also, recently, I saw a physician posting a picture of his kids in front of the school. You can clearly see the kids' faces and the name of the school. I mean, it's important to understand and ask yourself, do you want all of your followers to know what school your kids go to? Because there is a potential for other people to seek information about you or stalk you, right? Another big challenge is actually distraction and wasting time on social media, spending time on social media that you plan to do. So how can we overcome these challenges? I would say if you want to use social media for academic purposes, as an educational tool, you should create a professional account or a professional page and keep it really separate from your personal one. For example, here we are seeing great examples of professional account, Facebook account by Dr. Agarwal and Dr. Tolley on Instagram. You're seeing the education, like what he's currently doing, what his education is. And here you're seeing a professional headshot. Also in the background, this is me. This is his clinical research team. It's important to have a professional headshot. It's important to mention your education and your interests. But your post really should not include political views, depiction of intoxication, profanity, any type of discriminatory language. So you saw the example of an account, Facebook account here, but you can also create a Facebook page, professional Facebook page. It's very similar, but here I need to add Dr. Agarwal as a friend to be able to see his posts. But here you can just like this page. The other person does not have to approve this request. You can just like the page and follow all the posts that are posted by Dr. Mehta. Also, these pages actually allow you to schedule your posts ahead of time. And again, you can use the About section to describe your interests, your education, and if you have a website, you can also share that. So the other thing I would really recommend is personalizing your settings. And one of them is I recommend keeping the friend list private. So your patients or other followers don't see your friends, family members, and relatives. Because it's not very actually difficult to recognize your family members or your husband or your kids from the same last name. They probably have the same last name. They may have a profile picture taken together. So don't allow others to see your friend list. So you can do this by going to settings, then clicking on privacy and changing who can see your friend list from friends to only me. The other thing you can do is so sometimes, friends and family members can post your personal photos and they can tag your professional account. You probably don't want your patients, these can be pictures that you don't want your patients or other people to see, right? So I would recommend not allowing others to post to your profile directly. So this setting here allows you to review, this one here allows you to review the tagged picture before everyone sees it. So it gives you some control over your own profile and over the pictures that you get tagged by other people. So you can do this again. You're going to go to settings, profile and tagging, reviewing, and you will say review post you're tagged in before the post appears on your profile. So you're going to make this on, and similarly, this is going to be on. Lastly, it's not very unusual or uncommon right now for people to start fighting each other and posting unprofessional comments that includes sometimes profanity or discriminatory language. So if it happens under one of your posts, I would recommend either taking off the post altogether or disable comments. So Instagram very nicely allows turning off the comments. Basically, usually there's 3 dots at the left upper corner of the picture that you shared. And if you click on that, you can just click on this turn off commenting and it would disable all the comments. Facebook had a similar feature, but they disabled that feature as of 2021. So you can't do this on Facebook anymore. But you can take off the post altogether. Another thing you can do is to schedule your post, especially if you have a page. You can click on create post, and it's going to ask you, it asks you next, and how do you want to post this? And you're going to click on schedule. You're going to pick the time and date, and you're going to set the date and schedule. So this probably, if you're planning to post, let's say, one post weekly or one post monthly, you can plan this ahead of time very nicely if you have a Facebook page. It will also help you with the time management. If you feel like you're spending more time on Facebook than you're planning to do, then this can give you some, time. So that's all I had on Facebook and Instagram. Thank you so much.